Hello, I'm Alec Martinez. I'm one of the physical therapists here at Home and Rehab, and today we're doing the first video in a series of videos about vertigo, specifically what it is and what you can do about it. Today we're going to talk about the signs and symptoms of a couple different kinds of vertigo that are most common for people, and how you can tell if this is something that you should go see a professional about. We're going to start with the most common type of vertigo, something called Bppv, or Benign Paroxysmal Positional Vertigo, which is quite a mouthful. But the key word here is the word positional. People with Bppv tend to experience room-spinning sensations, especially when they roll over in bed. If you roll over to your left, for example, you'll experience a symptom set very similar to when you would spin around as a kid, look up at the sky, and watch the clouds go in circles. Very often people have this only on one side of the body, so when you roll to one direction, it is far worse than rolling the other way. You may also experience these symptoms at times when you are looking up or down in one particular direction, like if you are showering or tying your shoe. Again, the symptoms will be very similar, a full spinning sensation. This is different than a kind of vertigo known as a vestibular hypofunction, but can be just as common. For people with this, one of their inner ear nerves is affected more than the other side, and because of this, they'll have a lot of problems with quick head movements regardless of what position you're in. If you are looking quickly to the left, right, up or down, and often especially in low light conditions, or if you're having difficulty focusing on one object in particular. This type of symptom set may occur very quickly once after an infection, or may occur regularly over the years depending on the cause, and your doctor will help you figure out that cause based on the pattern of your onset. Now, something that often will mimic vertigo is something called orthostatic hypotension. Again, you will feel dizziness with position change, but the type of dizziness here is one of the more important things. You'll experience more of a sensation of lightheadedness, and will very often be when you change from positions like lying down to sitting up, or sitting up to a full stand. Again, that lightheaded feeling can be related to a type of blood pressure issue. Finally, another set of symptoms to watch out for is something called peripheral neuropathy, which is something very common in people with different types of diabetes. People who have difficulty feeling in their feet or in their hands have a harder time, of course, figuring out where their body is in space, which is one of the main causes in our brain of the symptom set that constitutes vertigo or vestibular issues. So if you've already been diagnosed with diabetes, and you just feel like you're in a general haze as opposed to feeling the particular issues we've already talked about, this still may be something that you may be able to address and does fall within the category of things that physical therapists tend to deal with. Along with physical therapists, your primary care physician, or specifically ENT specialists, may be able to help you out. So always feel free to talk to any of your healthcare professionals to decide who's going to be able to help you the most. We're going to do some more videos in the future about the different causes that may have led to your symptoms, and of course some things that you can do about it. Have a great day.